To help the patient that requires minimum assistance safely transfer from the bed to the chair, follow these steps. Position the chair angled toward the bed, but far enough away to allow a walker to maneuver between the bed and the chair. Apply a gait belt to the patient and follow the process previously described to help the patient stand with a walker. The minimum assistance patient can do most of the work on their own. Your job is simply to guide and support. Help the patient by supporting from the gait belt and holding it in the back of the patient, and guiding from the hips. Guide them as they turn their walker until they are in position in front of the chair. The patient should be directly in front of the chair, with the back of their legs almost touching it. The walker should be directly in front of the patient, nice and close, also nearly touching the chair. Instruct the patient to reach back to the armrests of the chair. Lean forward to bring their nose over toes and slowly sit down. You can guide and support the patient as they descend into the chair. Stand with a wide base of support and ensure your strength comes from your lower body and not your arms and back. When you need to get a minimum assist patient back into bed, first, utilize the previously demonstrated techniques for assisting a patient up with a walker and guiding them into position with the walker and gait belt. The patient needs to be in position at the side of the bed, with their back to the bed. You will help the patient to sit in the bed with a similar technique to sitting in the chair, but before you have the patient sit, make sure you won't need to boost them up after they lay down by having them sit down closer to the head of the bed. Lower the bed rail. Have the patient take side steps toward the head of the bed. Stand at the patient's side, toward the head of the bed, and stand with a wide base of support, and you can support and guide the patient by holding the gait belt with one hand and stabilizing the walker with the other. Once the patient is close enough to the head of the bed, have them reach behind them to reach the bed. Have them bend forward with their nose over their toes and sit back, pushing into the bed for balance as you hold the gait belt and help guide and ease them onto the bed. If the patient is sitting at the side of the bed, but is too low in the bed, you can assist the patient in performing lateral scoots to position them closer to the head before laying down. Have the patient push into the bed with their hands, and you can support and guide from the gait belt as they take small scoots toward the head of the bed. When they are in an appropriate position, have the patient lay down, or assist the patient to a supine position. If the patient requires two-person assistance, utilize this technique to get the patient to a standing position with a walker, and transition to a chair. Position the chair angled toward the bed, close to the bed but appropriately spaced to allow the patient room to maneuver the walker as they transition to the chair. With the patient in a seated position at the side of the bed, apply the gait belt. Place the walker in front of the patient. Have the patient's feet shoulder distance apart and touching the floor. Have each healthcare worker stand to either side of the patient, with a wide base of support and with one foot in front of and blocking one of the patient's feet from sliding forward. Each of you should hold the gait belt from behind the patient's back. Have the patient lean forward until their nose is over their toes. Push into the bed and stand. You and your partner will assist the patient from the gait belt. Have the patient stand up straight. With the patient in a standing position, use the gait belt to guide the patient as they turn with the walker. One healthcare worker should be to one side and in front of the patient, and the other should be to the other side and behind the patient, both supporting and guiding from the gait belt. When the patient is positioned in front of the chair, at least one healthcare worker should stand with their foot in front of one of the patient's feet to stop it from sliding. Have the patient reach back to the chair and begin to sit, while the two of you guide the patient from the gait belt. Stand with a wide base of support, and as you guide the patient down, lower the patient by primarily using your legs, not your arms and back.